Disclaimer: We Level Up is not promoting the use of Adderall and Vyvanse. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what's the difference between Vyvanse and Adderall? Discover the key differences between Adderall and Vyvanse, two popular psychostimulants. Adderall, approved in 1996, contains dextroamphetamine and levoamphetamine, while Vyvanse, approved in 2007, contains lisdexamfetamine. Both medications are commonly used to treat ADHD, but Vyvanse has the added benefit of also being approved for binge eating disorder. Adderall comes in immediate release and extended release forms, providing effects for 4-6 hours or 12 hours, respectively. Vyvanse, on the other hand, offers an extended release for about 10-13 hours, possibly even up to 14 hours. In terms of side effects, Vyvanse, being a prodrug, is considered to have milder effects than Adderall. The mechanism of action for Adderall involves inhibiting the reuptake of dopamine and norepinephrine, as well as releasing them from storage sites. Vyvanse, on the other hand, is metabolized into dextroamphetamine and acts by increasing the availability of dopamine and norepinephrine in the central nervous system. It's worth noting that Adderall has a half-life of 11-13 hours, whereas Vyvanse has a slightly shorter half-life of 10-12 hours. While Adderall can be obtained in a cheaper generic version, no generic option is available for Vyvanse. Both medications are potential drugs of abuse, but due to Vyvanse being a prodrug and taking longer to metabolize, it is considered to have a lower risk of abuse. 4 key differences between Vyvanse and Adderall. Vyvanse versus Adderall. Key differences includes: activation. Adderall takes effect quickly after ingestion, typically within 30 minutes to an hour. On the other hand, Vyvanse is a prodrug that needs to be metabolized in the body before it becomes active, so it takes longer to kick in, usually around 1 to 2 hours. Duration. Adderall has a shorter period of action, typically lasting around 4-6 hours. In contrast, Vyvanse is designed to provide a longer-lasting effect, often lasting up to 12-14 hours. FDA-approved age. Adderall is approved by the FDA for use in children aged 3 years and older and adults. Vyvanse is approved for treating attention deficit disorder or ADHD in children 6 years and older and adults. Insurance coverage. Insurance coverage may vary for Adderall and Vyvanse. Some insurance policies direct preliminary approval for Vyvanse due to its higher cost when comparing generic versions of Adderall versus Vyvanse branded drugs. Vyvanse versus Adderall medications choices may have different effects on individuals. Thus, the choice between the two medications should be made with your doctor based on your needs and circumstances. While both are controlled substances with a potential for abuse, there's a critical distinction. Vyvanse, a prodrug, only becomes active when metabolized by enzymes in the body. This means it can only be taken orally, unlike Adderall, which can be snorted or injected. Manufacturers of Vyvanse promote it as less vulnerable to abuse. Moreover, the unique biochemistry of prodrugs allows for efficient absorption and fewer adverse effects when the drug wears off. Take a closer look at how these drugs are metabolized, how frequently they need to be taken, and their potential for abuse. More differences between Adderall and Vyvanse. Adderall and Vyvanse are commonly prescribed medications for ADHD treatment, but they differ in several key aspects. Here are the primary differences between Adderall and Vyvanse. Composition. Adderall combines 2 stimulant drugs, amphetamine and dextroamphetamine, while Vyvanse contains only one active ingredient, lisdexamfetamine. Duration of action. Adderall has an immediate release formulation, which means it starts working quickly but has a relatively short period of action, typically lasting around 4-6 hours. Vyvanse, on the other hand, is a long-acting medication that provides a smoother and more extended effect, lasting up to 12-14 hours. Mechanism of action. Both Adderall and Vyvanse work by raising the brain's neurotransmitters, dopamine and norepinephrine. However, Vyvanse remains inactive until it is metabolized and converted into dextroamphetamine. This conversion occurs gradually, resulting in a smoother and more controlled release of the active drug. Abuse potential. Adderall has a higher potential for abuse due to its immediate release formulation and the presence of both amphetamine and dextroamphetamine. It is categorized as a Schedule II controlled drug by the Drug Enforcement Administration. DEA. Vyvanse, on the other hand, is classified as a Schedule II controlled substance but has a lower potential for abuse due to its prodrug nature and gradual conversion into the active form. Dosage flexibility. Adderall provides more flexibility in dosing as it comes in different strengths and immediate release formulations. Vyvanse, a prodrug with a single strength, offers less flexibility regarding dosage options. The choice between Adderall and Vyvanse depends on individual factors, such as specific symptoms, medical history, and personal preferences. Consulting with a healthcare professional is crucial to determine the most suitable medication for each individual's needs. Vyvanse versus Adderall. Weight loss. Vyvanse. Weight loss. Some individuals may experience appetite suppression and weight loss as side effects of Vyvanse. This can be attributed to the medication's stimulant properties, which can decrease appetite and increase metabolic rate. Adderall. Weight loss. Similar to Vyvanse, Adderall can also cause appetite suppression and weight loss as side effects. The stimulant properties of Adderall can reduce feelings of hunger and increase metabolism, leading to potential weight loss. It is important to note that the weight loss experienced with Vyvanse or Adderall can vary among individuals. Not everyone will experience significant weight loss, and individual responses may differ. Additionally, any weight loss observed should be monitored and discussed with a healthcare professional to ensure it is within a healthy range and not a result of excessive or unhealthy behaviors. If weight loss is a concern or becomes excessive, consulting with a healthcare professional is essential. They can assess the individual's situation and make any necessary adjustments to the medication regimen or provide guidance on managing weight-related concerns while using these medications. Vyvanse versus Adderall. Mood. Vyvanse and Adderall are commonly prescribed medications for attention deficit hyperactivity disorder, ADHD. While they have similar effects on focus, attention, and impulsivity, they may differ in their impact on mood. Regarding mood, Vyvanse may have some positive effects. As a stimulant, it can increase alertness, motivation, and energy levels, improving mood in some individuals. However, stimulant medications can also induce effects such as anxiety, irritability, and agitation, which may affect mood negatively in some instances. Individual responses to Vyvanse can vary, so it's essential to communicate any mood changes with your prescribing physician. Similar to Vyvanse, Adderall can have an impact on mood. It may increase energy levels, focus, and productivity, improving mood in some individuals with ADHD. However, as with any stimulant medication, there is a potential for side effects, including mood swings, irritability, or anxiety. Again, individual reactions can vary, so discussing mood changes with your healthcare provider is essential. In summary, both Vyvanse and Adderall can affect mood, which may vary from person to person. Some individuals may experience improved mood and increased motivation, while others may have negative mood changes or experience side effects. Working closely with your prescribing physician to monitor and adjust medication if necessary is crucial, ensuring the best treatment outcome for your specific situation. We Level Up is dedicated to delivering integrated care that fosters healing and supports long-term recovery. Their services encompass individual counseling, group therapy, behavioral therapy, and medication management. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.